and for the Health Equity and Social Justice 2020 conference, I'll be presenting about the in-hospital mortality and resource utilization of patients with COVID-19 by ethnicity, a preliminary report. So as we all know, coronavirus disease 2019, or COVID-19, quickly spread throughout China and the world, later being declared a pandemic by the WHO on March 11th. So looking sort of into history, disparities in hospitalization rates and mortality rates were reported during the 2009 H1N1 pandemic. And looking more closely now at COVID-19, initial data have indicated that racial and ethnic minorities may be disproportionately affected by this pandemic. Knowing that, in this study, we wanted to seek to further characterize the socio-demographic differences in COVID-19 resource utilization at a large coronary healthcare system. We hypothesized that among hospitalized patients with COVID-19, there are socio-demographic disparities associated with resource utilization. So we used a prospective cohort study using patients in the Northwestern Medical Health System from the dates of February to June of this year who tested positive for COVID. So these patients, these individuals who tested positive for COVID, we identified their demographic information and outcomes in the hospital to use that to compare Hispanic and Latinx individuals versus non-Hispanic and Latinx individuals and their outcomes. So going into the results, as we see in Table 1, the Hispanic and Latinx population in this investigation were younger, more likely to be male, to prefer Spanish, more likely to be self-paying, and had a lower median household income. In addition, the Hispanic and Latinx population had a higher median BMI, more likely to never have smoked tobacco, and had a lower prevalence of certain coexisting conditions. As we go more into the results in terms of the outcomes of these patients in these populations, the Hispanic and Latinx patients spent less time in the hospital, had lower intubation rates, had lower rates of hydroxychloroquine use, and fewer days from inpatient admission to ICU admission. The total time intubated were similar among groups, and in adjusted time to event analyses, ethnicity was not independently associated with ICU admission or in-hospital death. I do want to go further into some of these results. So for the lower rates of hydroxychloroquine use, the differences in hydroxychloroquine use may be attributed to changes in practice patterns. As we know, initially in the pandemic, hydroxychloroquine use was being studied to possibly treat COVID, and so their use was greater initially in the pandemic in February and March, and that happens to correspond with in our data, the non-Hispanic and Latinx individuals, they tended to be hospitalized more during that time period versus Hispanic and Latinx population who were found to be hospitalized greater in March and April. So we think that difference in use may be attributed to changes in practice patterns as the use became less. In addition, if we look into Table 2, we're kind of comparing the death rates and ICU admission rates between the two populations. And in Model 1, the unadjusted ethnicity model, we see that the Hispanic and Latinx population had a lower death rate. But once we include the covariates of age and sex in Model 2 and further other covariates in Model 3, we see that difference goes away. So when controlling for age and sex in Model 2, the difference has gone away, and this kind of points to the fact that Hispanics and Latinx patients had a lower death rate, likely because they were the younger population. Going into the limitations, the data was limited to a single health system with quaternary care facilities and may not be generalizable to other populations. At the end of the study period, there were also 171 patients that were still admitted to the hospital. The unknown outcomes could have changed the result in the investigation. However, the number of patients still admitted in both groups is not significantly different. We also did not include oxygen saturation or biomarkers that could have dictated decisions for intubation. And given the novelty of COVID-19, it is possible that not all information related to the virus that is relevant was studied, and thus misclassification remains possible. In conclusion, this study compares epidemiological characteristics of hospitalized Hispanic Latinx patients and non-Hispanic Latinx patients who were underrepresented in the COVID-19 medical literature to date. Awareness of the epidemiologic factors associated with in-hospital mortality and resource utilization for SARS-CoV-2 infection and the corresponding disparities that exist is a requisite step in improving health equity.